Locally, some business leaders are worried about what a national health care system might mean to them and their bottom line. Others believe the democratically charged legislation is misguided, while those backing the change say it's essential for America. Fox 11's Evan Peralt brings us balanced coverage.
With health care reform a hot topic, the 468-page House bill is getting Tom Siskey of the Fox Cities Chamber of Commerce pretty fired up.
I think we deserve to be fired up.
He's upset about the bill's potential cost to small businesses.
We think it'll be a job killer for a small business. That's where the majority of the tax or the costs are going to wind up.
However, Congressman Steve Kagan says it will do just the opposite, stimulating job growth and helping the small businessman.
This will help to alleviate their greatest overhead expense, and that is for health care coverage of themselves, their families, and their employees.
But Dr. John Toussaint of the ThedaCare Center for Healthcare Value says the congressional proposals are just missing the mark completely.
What I'm disappointed in is that we have really focused completely on the insurance side and we haven't focused on the delivery side.
Before insuring everyone, he says there's easily $1 trillion of waste that can and should be trimmed out of the way health care is currently delivered.
That could easily pay for any kind of insurance coverage for all Americans.
Over at the Chamber, Siskey just hopes congressional leaders don't bow to political pressure to hammer this quickly through Congress before their August recess.
I think we have a right to be worried. We have a right to be concerned.
I think it's a good bill, and I've never seen a perfect bill move through Congress.
I believe that we're on a socialist path.
But the final path still isn't finalized, and the true ramifications of this health care bill, whatever they may be, won't be known until it's set in stone. Evan Peralt, Fox 11 News.
Regular folks on College Avenue chimed in today on the president's plan. Tonight, we have another view.
I'm like in the middle. I think parts of it are good, but I think parts of it are going to raise the deficit too much.
I think it's an all right idea. I am not really over enthused about government control and, with the health care, but something's got to be done.
I don't think anybody really understands it all, and I'm not sure where it's going to go.
I don't know all the details of it yet. So far from what I have heard, I'm kind of against it. Sounds like it's going to hit the taxpayers harder than anything else. So.
The plan that is moving through the House is meant to cover 50 million uninsured Americans. Under it, the government would ensure that every person, regardless of income or health, has access to an affordable insurance plan. The plan will add taxes to those making over $250,000 a year. Plus, the House plan requires individuals to have insurance. Those who opt not to have it will be charged 2.5% of their income. Employers who don't provide coverage would pay a penalty equal to 8% of workers' wages.